Imagine a result so enduring, not a single hair has budged from its allotted space in almost 15 years. And it's results like these that fortify the reputation of Darling Buds Clinic as being the only clinic in the world presenting cases 10 to 15 years old on a regular basis. And if you suspect this claim, go check it out. Why do others not present such cases, you may ask? Well, ask them. So today we're presenting Sharry Mann, the much celebrated Punjabi pop singer who experienced Sikh-pattern traction alopecia at an early age and underwent surgical hair restoration at my clinic using the DHX method some 15 years back. In this video, see his exceptional transformation that defied his expectations, and he never believed that the result is going to last him 15 years.
ਝੋਨਾ ਵੱਢ ਕੇ ਕਣਕ ਬੀਜਣੀ ਝੋਨਾ ਵੱਢ ਕੇ ਕਣਕ ਬੀਜਣੀ ਬਾਪੂ ਹੋਇਆ ਬਿਮਾਰ ਨੀ ਚੰਡੀਗੜ੍ਹ ਵਾਲੀਏ ਹੁਣ ਨਹੀਂ ਮੁੜਦੇ ਆ। ਸਤਿ ਸ਼੍ਰੀ ਅਕਾਲ ਦੋਸਤੋ, ਮੈਂ ਹਾਂ ਤੁਹਾਡਾ ਆਪਣਾ ਸ਼ੈਰੀ ਮਾਨ। ਚੰਡੀਗੜ੍ਹ ਮੈਨੂੰ ਮੁੜ ਕੇ ਆਉਣਾ ਪਿਆ ਕਿਉਂਕਿ ਹੇਅਰ ਟ੍ਰਾਂਸਪਲਾਂਟ ਕਰਾਉਣਾ ਸੀ ਡਾਰਲਿੰਗ ਬਡਸ ਵਾਲਿਆਂ ਤੋਂ, ਔਰ ਟ੍ਰਾਂਸਪਲਾਂਟ ਤੋਂ ਬਾਅਦ ਤੁਸੀਂ ਦੇਖ ਹੀ ਸਕਦੇ ਹੋ ਮੇਰੇ ਵਾਲਾਂ ਦਾ ਰਿਜ਼ਲਟ ਕਿੰਨਾ ਵਧੀਆ ਆਇਆ। ਸੋ ਥੈਂਕਫੁਲ ਟੂ ਡਾਕਟਰ ਪੱਟੀ ਜਿਨ੍ਹਾਂ ਨੇ ਇੰਨਾ ਵਧੀਆ ਮੇਰਾ ਹੇਅਰ ਟ੍ਰਾਂਸਪਲਾਂਟ ਕੀਤਾ, ਅਤੇ ਸਾਰੀ ਟੀਮ ਦਾ, ਡਾਰਲਿੰਗ ਬਡਸ ਦੀ ਸਾਰੀ ਟੀਮ ਦਾ ਮੈਂ ਦਿਲੋਂ ਥੈਂਕ ਯੂ ਕਰਦਾ, ਕਿਉਂਕਿ ਜਦੋਂ ਮੈਨੂੰ ਕੰਪਲੀਮੈਂਟਸ ਮਿਲਦੇ ਨੇ ਤੁਹਾਡੇ ਸਾਰਿਆਂ ਵੱਲੋਂ ਮੇਰੇ ਵਾਲਾਂ ਨੂੰ ਦੇਖ ਕੇ ਤਾਂ ਮੈਨੂੰ ਬਹੁਤ ਖੁਸ਼ੀ ਹੁੰਦੀ ਹੈ, ਔਰ ਮੈਂ ਹਮੇਸ਼ਾ ਫਿਰ ਇਹਨਾਂ ਦਾ ਥੈਂਕ ਯੂ ਕਰਦਾ ਹੁੰਦਾ। ਸੋ ਡਾਰਲਿੰਗ ਬਡਸ, ਤੁਸੀਂ ਵੀ ਜੇ ਕੋਈ ਹੇਅਰ ਟ੍ਰਾਂਸਪਲਾਂਟ ਕਰਾਉਣਾ ਹੋਵੇ ਤਾਂ ਜ਼ਰੂਰ ਇੱਥੇ 17 ਦੇ ਵਿੱਚ ਪਹੁੰਚੋ ਅਤੇ ਨਾਲੇ ਚੰਡੀਗੜ੍ਹ ਦਾ ਗੇੜਾ ਮਾਰ ਜਾਓ। ਸੋ ਇੱਕ ਵਾਰੀ ਫੇਰ ਮੈਂ ਆਪਣੇ ਵੱਲੋਂ ਡਾਰਲਿੰਗ ਬਡਸ ਦਾ ਤਹਿ ਦਿਲੋਂ ਥੈਂਕ ਯੂ ਕਰਦਾ। ਲਵ ਯੂ।
This celebrity spotlight magnifies the exacting precision required because celebrities are not forgiving. Celebrities are not forgiving because of their high visibility. Do one wrong step and you can pack up your clinic and go home. Yet, the DHX technique has delivered time and again on a regular basis and delivered proudly. The fact that Sharry Mann is a well-known singer-actor enhances visibility and public trust in the procedure, doing good for the reputation of surgical hair restoration wherever in the world you might want to get it done. Traction alopecia, mind you, is no ordinary male pattern baldness. The scar-riddled recipient bald area demands much more attention than the usual surgical skill for a surgical hair restoration in androgenic alopecia. Sikh-pattern traction alopecia, unlike androgenic alopecia, is not hormone dependent, is not DHT dependent. The damage is both mechanical and structural. Sikh-pattern traction alopecia primarily stems from prolonged tension inflicted by tight hairstyles such as a juda, or which can be called as a bun or a top knot, which is further aggravated by tying a dastar or a turban, or in young boys a patka, which is a large hanky-sized cloth used to cover this hairstyle. And this hairstyle is quite common in both male and female Sikhs even today. Rather than progressive miniaturization as seen in androgenic alopecia, Sikh-pattern traction alopecia is marked by scarring and perifollicular fibrosis. And these two things, when they occur together, significantly compromise the blood supply to the recipient bed. And this is the challenge in Sikh-pattern traction alopecia. And patients being young with no other areas of baldness, as seen in androgenic alopecia, where the thinning might be uniform all over, they demand the same density as in the other areas of the head. They want the same density to be replicated. Though one can get away with lower density in most cases of androgenic alopecia, patients here have very high density expectations, and reality sometimes does not realign with their expectations. And what are the challenges of treating Sikh-pattern traction alopecia? Let's enumerate them here. So persistent traction leads to perifollicular fibrosis, that is scarring around the follicles deep under the skin. So successful restoration must overcome this reduced vascularity of blood supply, in the scarred bed. Unlike androgenic alopecia, Sikh-pattern traction alopecia cases do not usually progress hormonally. That is, there is seldom any progression if the inflicting mechanical stress has been removed. Patients want high-density outcomes to obscure this traction damage to the hairline. Crafting a natural-looking frontal hairline and the large bald temple areas requires perfect angulation, natural-looking density, and seamless integration, giving a natural look. The DHX technique is slightly altered since we have copious amounts of scar tissue. Implanting grafts in scar tissue needs some salient changes in technique, and which I have gathered over time doing several cases. We do the largest number of cases because I am situated in Punjab, the heartland of the Punjabi Sikh community. And this ensures minimal transection, precise placement, and optimized follicle survival, even in scarred tissue. And here's empirical proof. Photographs before he underwent a hair transplant, then photographs 6 months later, and then 2 years, 5 years, and now almost 15 years after his hair transplant procedure. Look at the exceptional density, natural angulation, celebrity-like hairstyle, and seamless integration. Not a single implanted follicle displaced in these 15 years, which is a living testament to our meticulous technique and durable graft survival using the DHX trademark technique. In my considered view, the Sharry Mann case stands as one of the most compelling celebrity examples of Sikh-pattern traction alopecia restored by surgical hair restoration. And it encapsulates 3 pillars of ethical and surgical excellence. Sharry Mann's case elevates visibility and public impact of surgical hair restoration, which allays the negativity that revolves around hair transplants amongst many patients' minds, because there are so many failures which people see at airports, at bus stands, at railway stations. It demonstrates verifiable durability and aesthetic success, a natural-looking hairline which withstands the buffets of time. It reinforces that DHX, which is a tailored form of FUE, is superior for high-density demands even in scarred scalp environment. It's rare to find a result so pristine in Sikh-pattern traction alopecia. Not a single transplanted hair out of place, even after a decade and a half. One might say in the world of hair restoration, this is where excellence isn't just maintained, it's immortalized. That is why DHX is not merely a technique. It's a promise etched in keratin. Well, thank you for watching. If you have any questions, let me know. Any questions about Sikh-pattern traction alopecia, hair transplant in Sikh-pattern traction alopecia, how to avoid Sikh-pattern traction alopecia, I'll be happy to answer. Have a nice day and God bless you.